Welcome to the Deep Dive. Today we're tackling something I think many of you have probably come across. Tetracycline antibiotics.
Mm-hmm.
You, our listener, were curious to understand these, well, pretty common medications,
Mm-hmm.
a bit better, how they actually work, what they're used for, and, the key things to keep in mind.
Exactly. And it's a good topic. Tetracyclines are a class of antibiotics with a really interesting backstory.
Oh, yeah?
They were first discovered, believe it or not, from a common soil mold, and chemically, what makes them distinct is this four-ring structure.
Hence the name tetracycline.
Precisely. That's where the name comes from. And over the years, scientists have developed newer versions, kind of tweaking that structure to, well, improve how they get absorbed by the body, things like that.
Okay, so it's not just one single drug we're talking about. It's a whole family.
Right, a whole class.
So to give us a clearer idea, what are some of the common examples? Ones we might have heard of.
Sure. Well, the original is just called tetracycline. Pretty straightforward. Then you have some really common ones like doxycycline and minocycline. Probably the most prescribed these days.
Right, I've definitely heard of those.
The family also includes others like dimeclocycline, and then some of the more recent ones like eravacycline, omadacycline, and sarecycline, which is often used for acne.
Okay, quite a few then.
Yeah.
That gives us a much better sense of the group of drugs we're diving into.
Right.
So your request was really to understand how these drugs fight infections, what kinds of infections they target, and the important things to be aware of if you ever need to take them.
Yeah.
So our mission today is to give you that clear picture, but hopefully without getting totally bogged down in super technical jargon.
Exactly. Let's try and keep it practical. So maybe start with the core question. How do tetracyclines actually work against bacteria?
Yeah, how do they do it?
Well, what's interesting is that they're what we call bacteriostatic.
Bacteriostatic. Okay, what does that mean exactly?
Think of it less like directly killing the bacteria outright and more like cutting off their ability to reproduce. They stop them from multiplying and spreading.
So they put the brakes on the bacterial growth, letting the immune system maybe catch up.
Pretty much, yeah. They prevent the bacterial colony from expanding. And they do this by interfering with a really crucial process inside the bacterial cells, making protein.
Protein synthesis, right.
Bacteria, like us, need to constantly make proteins to, function, grow, repair themselves. Tetracyclines basically gum up the works. They block part of the bacterial ribosome that's the protein-making machinery.
So throwing a wrench in the works at a really fundamental level.
Exactly. Stops them producing the proteins they need to survive and multiply.
Okay, that makes sense. Now, I think I read somewhere, maybe in the PEP for this, about potential effects on our cells, human cells, especially at high levels.
Yeah, that's a really critical point to understand. The part of the bacterial ribosome that tetracyclines target. Well, it has some similarities to structures inside our own cells' mitochondria.
Mitochondria.
The cell's power plants, right?
The very same. So the concern is, if tetracycline concentrations in the body get really high, they could potentially have some, let's say, off-target effects on our mitochondrial protein synthesis too.
So it's kind of like a key that fits the bacterial lock really well, but might jiggle our similar lock a bit if you force it.
That's a decent analogy, yeah. It highlights why proper dosage and, medical supervision are so important. We want enough to stop the bacteria, but not so much it causes problems for us.
Got it. Target the bacteria, but be mindful. Okay, so what kinds of infections are these drugs typically used for? The list looked pretty long.
It is quite broad, actually. Tetracyclines have what we call a broad spectrum of activity. They work against a pretty wide variety of bacteria.
Like what sort of things?
Well, they're effective against some of the perhaps less common infections people hear about, like those caused by Rickettsia species.
Rickettsia, that's like Rocky Mountain spotted fever, right? Tick-borne stuff.
Exactly, things like that. Also infections caused by Mycoplasma pneumonia. Oh, walking pneumonia.
That's the one. And also Borrelia recurrentis, which causes relapsing fever, another tick thing.
Okay, so some specific, maybe less everyday infections? What about more common ones?
They definitely have uses there, too.
Yeah.
They can work against Haemophilus influenza, which, despite the name, causes things like ear infections, not the flu, and Haemophilus ducrei. Also, rarer but serious things like plague and tularemia.
Wow, plague. Seriously.
Yes, caused by Pastorella pestis and Pastorella tularensis. Also things like Bartonella, various bacteroid species, Vibrio comma, that's cholera.
Cholera, okay.
And Vibrio foetus, Brucella species too. And even some common gut bacteria like certain strains of E. coli, Enterobacter aerogenes, Shigella, which cause, gastrointestinal upset.
That is a surprisingly wide range. It covers a lot of ground.
It really does. It also includes Acinetobacter, Klebsiella species, sometimes Diplococcus pneumonia, and even some strains of Staph aureus, though resistance can be an issue there.
Right. Antibiotic resistance is always a factor.
Always. They're also used for agents causing psittacosis or ornithosis. That's from birds' lymphogranuloma venereum, granuloma inguinale. And importantly, they're often a good option when someone has an infection that would be treated with penicillin, but they're allergic.
Ah, so a penicillin alternative. That's useful.
Very useful. Plus, specific uses like treating acne, often long-term, low-dose minocycline or sarecycline, and uncomplicated urinary tract or genital infections caused by chlamydia trachomatis.
Chlamydia, okay.
And even sometimes as an add-on treatment for certain protozoal infections like specific types of malaria, believe it or not.
So a real workhorse in the antibiotic toolkit then.
You could definitely say that.
Okay, so once you take one, say, a doxycycline pill, what actually happens to it in your body? How does your system handle it? Pharmacokinetics, right?
Yep, pharmacokinetics, how the body acts on the drug. So tetracyclines are usually taken orally, by mouth, and they get absorbed from the GI tract, your gut. But, and this is a big but the absorption isn't always complete, and it can be significantly messed up by certain things you might have in your stomach at the same time.
Like what? This sounds really important for people to know if they're prescribed these.
Absolutely crucial. Food in general can reduce absorption, but especially dairy products, milk, cheese, yogurt.
Calcium.
Exactly. Calcium is a big one.
Huh.
Also, iron supplements, magnesium, often found in antacids or laxatives, zinc supplements, aluminum salts, also in antacids, even bismuth salts, like in Pepto-Bismol. All of these can bind to the tetracycline in the gut and stop it from being absorbed properly.
Wow, okay. So you could take the pill, but if you wash it down with milk or take it with your multivitamin with iron, you might not be getting the effective dose you need. It drastically reduces how much gets into your bloodstream.
So timing and what you take it with is really, really key.
Absolutely. Once it is absorbed, tetracyclines tend to concentrate quite a bit in the liver.
And the main way the body gets rid of them is through the kidneys, in the urine. Though some of the newer ones have other ways out too, which can be useful if someone has kidney issues.
And how long do they stick around in the body? The half-life.
Right, the half-life. That's how long it takes for half the drug to be eliminated. For tetracyclines, it generally ranges from about 12 hours up to maybe 25 hours, depending on the specific drug.
Which explains why you take them once or twice a day, usually.
Exactly. It keeps a steady, effective level in your system. Another point, they can cross the placenta during pregnancy.
Which we'll come back to, I'm sure.
Yes.
Yeah.
And they can also pass into breast milk, though typically in low concentrations.
Okay. And how do they actually come? Or are they all just pills?
Mostly pills or capsules for taking by mouth. Yeah, that's the most common. But some, like doxycycline and omadacycline, can also be given intravenously through an IV drip, usually in a hospital.
Okay, for more serious infections, perhaps.
Often, yes. Or if someone can't take pills. Minocycline is quite versatile. You can get it as a topical cream or foam for acne, for instance, but also as IV and oral forms. Eravacycline is currently only IV.
So different options depending on the need. Got it. Now let's talk about the really important considerations. Who should definitely not take tetracyclines? The contraindications.
Right. Top of the list. Anyone with a known allergy, a hypersensitivity to any tetracycline drug. If you react to one, you'll likely react to others in the class.
Okay, standard allergy warning. What else?
Because of those effects on developing bones and teeth we touched on, they are generally contraindicated during pregnancy.
Right. Crosses the placenta.
Exactly. And also for breastfeeding individuals because it can pass into the milk.
Okay. Pregnancy and breastfeeding, definite no-goes generally. What about kids?
That's the other big one. Tetracyclines should be used with caution or often avoided if possible in children under 8 years old.
Same reason. Bones and teeth.
Precisely the same reason. They can bind to the calcium in developing teeth, causing permanent yellow-gray-brown staining and potentially affect bone growth as well. It's a risk-benefit calculation the doctor has to make very carefully.
Those sound like really critical warnings for those groups.
Yeah.
Okay, what about the potential downsides for adults who can take them? Side effects, adverse effects.
Like pretty much all medications, they can have side effects. The most common ones tend to involve the GI system.
Stomach issues.
Yeah. Nausea, sometimes vomiting, diarrhea, general abdominal pain. You can also get glossitis, which is inflammation of the tongue, or dysphagia, difficulty swallowing. And though it's rare, there is a risk of serious liver toxicity, hepatotoxicity.
Okay, GI upset is common with lots of antibiotics, unfortunately.
Right.
But the bone and teeth thing, does that affect adults too, or mostly just the developmental stage?
The major concern is definitely during development, pregnancy, and early childhood. However, because tetracyclines do have that affinity for calcium, they can accumulate in adult bones and teeth too. It's generally less likely to cause the dramatic staining seen in kids, but prolonged use might theoretically have some skeletal effects, though it's not considered a primary risk for most adults.
Good to clarify. The big warning is for pregnancy and kids under 8. What other side effects might people run into?
Okay, skin effects are pretty notable. Photosensitivity is a big one,
Yeah.
meaning your skin becomes much more sensitive to sunlight. You can get sunburned really easily, sometimes quite severely. So sunscreen, hats, protective clothing are important if you're on tetracyclines and going outside. Skin rashes can also occur.
Right. Photosensitivity, that's a common one to warn about. Anything else?
Superinfections. Because tetracyclines are broad spectrum, they kill off a wide range of bacteria, including some of the good, normal bacteria in your gut or elsewhere.
Which lets other things overgrow.
Exactly, like candida yeast, leading to thrush or yeast infections. Or sometimes other resistant bacteria can take hold. Less common, but possible, are hematological effects, things like anemia, or a drop in white blood cells or platelets, suggesting some bone marrow suppression. And, of course, hypersensitivity or allergic reactions, which can range from a mild rash to, rarely, a severe anaphylactic reaction.
Okay, so quite a spectrum of possibilities, from common GI stuff to rarer, more serious issues. What about interactions? We talked about food and minerals blocking absorption. Any interactions with other drugs?
Yes, there are some important ones. A key one is with digoxin.
Digoxin. That's a heart medication, right?
Yes, used for things like heart failure or atrial fibrillation.
Yeah.
Taking tetracyclines at the same time can actually increase the absorption or decrease the elimination of digoxin, leading to higher levels in the body and potential toxicity.
So if you're on digoxin and need a tetracycline,
Your doctor needs to be aware and monitor your digoxin levels very closely. The dose might need adjusting.
that's a really crucial interaction to know about.
Yeah.
And just to circle back on the food and mineral thing, because it seems so important for making sure the drug works, what's the practical advice? How should you take oral tetracyclines?
The general rule for most oral tetracyclines is to take them on an empty stomach.
Okay.
That usually means about 1 hour before eating or waiting 2 to 3 hours after eating, and take it with a full glass of water, not milk.
Right. Water only. And definitely avoid those antacids, iron pills, multivitamins around the same time.
Exactly. Separate the doses by at least 2, preferably 3 hours. Now, there's a caveat.
No.
If the tetracycline causes really bad stomach upset, like significant nausea or pain, sometimes the doctor might say it's okay to take it with a small amount of food, but specifically non-dairy food.
Ah, okay. So it might reduce absorption a little, but it's better than not being able to tolerate the medication at all.
That's the trade-off, exactly. It's a balance. Always best to follow the specific instructions from your doctor or pharmacist, because doxycycline and minocycline are sometimes a bit less affected by food than the original tetracycline.
Makes sense. Always check the label and the specific advice for your prescription.
All right.
Could we maybe zoom in on one as an example, like the original tetracycline? Just summarize its key profile.
Sure, the prototype, tetracycline itself, its main indications are, as we listed, a variety of infections caused by susceptible bugs, respiratory, skin, some STIs, those rickettsial diseases, etc. Also used for acne and as that penicillin alternative sometimes.
And how it works.
Inhibits protein synthesis in the bacteria, so it's bacteriostatic. Stops them multiplying.
Right. And when you take it orally,
Onset varies a bit, but it typically reaches its peak level in your blood in about 2 to 4 hours. Its half-life is a bit shorter than some others, maybe around 6 to 12 hours. Mostly gets out via the urine.
okay. And the main side effects specifically linked to tetracycline, the ones to really watch for.
Again, nausea, vomiting, diarrhea are common. Glossitis, sore tongue. And that big one, tooth discoloration and potential issues with bone formation if used during tooth development, so pregnancy and kids under 8. Also, potential for bone marrow suppression in rare cases. Photosensitivity is significant. Risk of superinfections like yeast, skin rash, and if you use a topical form, maybe some local irritation.
That's a good snapshot of the original. So thinking about all this, for healthcare professionals or even just for us as informed patients trying to understand these drugs, what are the key takeaways, the sort of nursing considerations or practical points for using tetracycline safely?
Well, several crucial things. First, always check for allergies to tetracyclines before starting.
Number one.
Number one. Then, get a good medical history. Any kidney or liver disease? Is the patient pregnant or breastfeeding? How old are they, especially if under 8?
Okay, assess the patient context.
Exactly.
Yeah.
And ideally, you want culture and sensitivity testing done.
The CNS test.
Right. To confirm that the bacteria causing this specific infection are actually susceptible to the chosen tetracycline. You don't want to use it if it's not going to work and contribute to resistance. Use the right tool for the job.
Makes sense. Don't use a broadsword if you need a scalpel or if the sword won't even cut it.
Kinda, yeah. And during treatment, especially if it's prolonged or in someone with existing issues, monitoring kidney and liver function periodically is a good idea.
Okay. What else for the patient?
Huge one. Educate the patient on completing the full course of antibiotics. Even if you feel better after a few days, finish the prescription. Stopping early can lead to relapse or resistance.
The classic antibiotic advice, always important.
Always. And provide really clear instructions on how to take it. That empty stomach, full glass of water, avoiding dairy, antacids, iron, etc. around dosing time.
Be really explicit about those interactions.
Very explicit. Also, make sure the patient knows about potential hypersensitivity reactions, what to look for, like rash, hives, difficulty breathing, and to stop the drug immediately and seek help if that happens.
Okay. Be alert for allergies.
Definitely. Help them with managing side effects, too. For GI upset, maybe suggest small, frequent meals, good mouth care if their tongue is sore, drinking enough fluids.
Practical tips.
And monitor or teach them to monitor for signs of superinfection like new white patches in the mouth or vaginal itching. And definitely emphasize the photosensitivity precautions. Sunscreen, protective clothing, avoiding excessive sun exposure.
Sun safety is key with these.
It really is. So overall, it boils down to thorough assessment, choosing the right drug based on sensitivity testing if possible, careful patient education on dosage, administration, those crucial interactions, potential side effects, and when to seek help.
This has been incredibly thorough.
Right.
So just to wrap up the main points, tetracyclines are bacteriostatic. They stop bacteria multiplying. They treat a really broad range of infections, but their absorption is tricky. Watch out for food, dairy, minerals. Big warnings for pregnancy, breastfeeding, and kids under 8 because of bone and teeth effects.
Wonderful point.
And common side effects like GI upset and photosensitivity, plus potential for interactions and superinfections. Safe use really depends on knowing all this and following the medical advice closely.
You've got it. That's a great summary. And maybe a final thought for you, the listener. If you're ever prescribed any medication, even something that seems as common as an antibiotic like tetracycline, try to be an active participant.
Ask questions.
Absolutely. Ask your doctor, ask your pharmacist, how does this work? How exactly should I take it? What should I watch out for? Don't hesitate. Understanding these things, even for common drugs, is really important because they all have nuances in how they work in your body.
Excellent advice. Be informed. Be engaged in your own health care. Well, thanks for joining us for this deep dive into tetracycline antibiotics.
That's my pleasure.
Until our next exploration, keep asking questions and stay informed.